Hey everybody, Dr. Dave Marquis here, and today I wanted to share with you an important concept around this topic called shedding. Many people have used that term as something new, and it's not. And it's not new at all. It's actually been a natural process by which we give and receive infectious disease over millennia. And it's something that, for whatever reason, over the past 3 years, those individuals that were receiving the shot, it was almost a taboo to imply that shedding could occur around that process. That, I think, was a huge disservice because of what we saw in the reality of shedding after individuals received the shot. I wanted to talk a little bit about that today. If you go back to the beginning of time when individuals started to acquire infections and they would cough or sneeze or sweat or share saliva in drinks or spoons or forks or whatever manner, bed sheets, wherever it is, infectious matter transfers from one individual to another. And if your immune system happens to be down, compromised, and you happen to acquire enough of this either viral or bacterial material from another individual, your immune system is now going to have to do something with that. And that usually translates to an infection in you. Okay? So it's just a very normal biological process. It's actually a gift in terms of us each learning from each other's immune system. That's why community is so important when people have infections. Not so that you get sick, but so that you teach your immune system what it needs to be aware of. And through this process over millennia, we've all built robust immune systems until we don't, when we start actually insulting our immune system and suppressing it. Relative to this shot, some of the interesting things in a bad way that we saw huge amounts of, largely centered around menstrual disorders in females, where those went up like 8,000% over the last 3 years in individuals that hadn't received the shot when they were in near vicinity of those who had. And I personally have seen countless women over the last 3 years who had protracted bleeding menstrually when their partner received the shot. They hadn't, and for like some of them 9 to 12 months had persistent menstrual bleeds. And then conversely, I saw just the opposite in other females where they had a normal menses for their whole life up until that point, and then suddenly they didn't. Their period just stopped. And I can't tell you how many I saw where it was just gone for like 6 months, and then when it restarted, it was this whole new entity to them, where now they had what's called dysmenorrhea, where it was extremely painful, and they would have heavier bleeds than they ever had in their life with lots of clotting. And they're like, I don't know what happened. The only thing chronologically that happened is that my partner received that shot, and then the next month I didn't have a period, or in the next month I started bleeding and I didn't stop. In my observation, that transference of immune intelligence was very real and is very real. There's a recent study that was put out by the University of Colorado School of Medicine that actually looked at this in terms of aerosolized transfer. And they showed conclusively that it doesn't isolate itself just to individuals who are sick, but it was also to this population that was receiving the shots, and they were doing it by measuring IgA, immunoglobulin A and G, in the sinus cavity. And we typically look at different immunoglobulins in our nasal cavity and in our saliva and in our bloodstream to get an awareness as to what we're showing immunity to. For example, IgM would be an immune player that generally would become more active anytime we're actively fighting an infection. Whereas IgG would be something that is in our immune system that connotes a prior awareness of an infection. And that's really what you want. So individuals who were able to acquire the infection without getting sick and produce IgG antibodies, that individual has a very competent immune system, and they've actually acquired what we all talk about in herd immunity, where they actually received some intelligence and now they were able to move on. Well, that's great, and that's how the immune system should function. And it's really cool that they were able to show that this is happening in the general population relative to the most recent topic that so many people were receiving shots for. The damning thing is all the negative side effects that happened around this particular one and continue to happen. Every time there is a new rash or development of shots that people are advised to get, what we see collectively is an uptick in these other symptomologies that never really were on our radar before, whether they be myocardial, whether they be cognitive, whether they be menstrually related. There are so many negative side effects that I see in patients secondary to this association in time and space when one individual receives that shot and another one doesn't, that it's a very frustrating process to help people protect themselves. It's so many people come to me and they say, what can I do to live in this world right now and not have a negative impact from the choice that other people are making when they put that into their body, and their immune system is by design going to respond and they're going to be shedding. What can I do? Here's a few things that I have seen to be helpful, but I don't have a solid answer as to, is there a blanket protection other than just not going outside? And that's not an answer. This thought came to me actually as a result of a conversation with a dear patient. Now, I'm going to give her a shout out. Stacy, thank you for bringing this to my mind. I think that it is an important topic for people to hear. The ability for people to have some type of control over this involuntary exposure to things that are just ambiently now in the air and can be transferred through body fluids and respiratory droplets. These are all documented things, not making that up. Things that an individual can do appear to be those things that help to bind and help your immune system to be more acutely aware without being in overdrive. Binders. I have 3 binders, and they actually do help quite a bit. One is called Pecto-Sol, and it's a citrus pectin that is chewable or drinkable, and it crosses the blood-brain barrier. It's a wonderful binder. I personally prefer the chewable kind. It's just easier to take, but they both work equally well. Another one is N-acetylcysteine, and this is the one that, interestingly, the FDA was trying to pull for a period of time, not for any good reason other than, well, I won't go down that road. N-acetylcysteine, it's a wonderful binder, and it turns into glutathione, which honestly is one of your best friends in terms of managing inflammation and helping to regulate your immune system and its function. The last binder is in a blended family, and it's a rare earth mineral blend. And so it's a blend of fulvic, humic acid, and zeolite, which is technically a clay. And there's several different companies that make some of these. I really like some from Cellcore. There's another one that Ortho puts out called Z Binder. These are really good products to have on hand that you can just use prophylactically that help your body to be hyper capable of grabbing stuff that you might be breathing in or bringing into your body in some fashion that now it can bind and be removed. Now, 2 other things that you can do, and I strongly encourage people to do this. One is colloidal silver spray that you can stick right into the nasal cavity. And colloidal silver works in 2 ways. It is an immune stimulant for your T cells, but it simultaneously has direct action against anything that shouldn't be in the nasal cavity or in your mucous membrane, and it can kill it. This is a really useful tool to just have a 3 milliliter bottle of that in your pocket or in your purse and use it anytime you walk in or out of a store, or you get on an airplane, or you're out in public. Squirt, squirt, done, okay? Something that I generally have in my car, in my briefcase, or in my home bathroom, and here in my office is also a micro nebulizer. And I'll use a little bit of water and hydrogen peroxide in that, and sometimes I'll actually nebulize some of the colloidal silver in the water in that. And that's another wonderful tool, very similar to the nasal spray of the colloidal silver, but it's a way that you can treat your airways to address directly this micro aerosolization of traveling viral or bacterial matter from one individual to another. In other words, it puts a barrier in your airways to help to clear out some of the stuff that you might have involuntarily ingested. These are just some thoughts, and I'm not saying that, hey, this is going to treat, cure, or prevent anything, but in my experience, it may. It may actually prevent some things that you don't want to have to deal with. It may help you keep your airways clear, and it may help your immune system function more appropriately by taking these proactive steps and basically just being cleaner relative to your environment. That's how I see those steps. Not to demonize any individual's choices. What people choose to do is totally up to them. But I think that we should be aware that transference of infection is a very real thing, and it always has been. And we've upped that game because of choices that are being imposed upon us that many people do embrace, and that affects you and me. And so that's something that you want to be aware of and take proactive steps so that you can keep yourself healthy. Because that's my ultimate goal, is to help each of you be well.